Welcome back. Let's talk about the nursing process. The nursing process is the way we work through problems, issues. So for every problem or issue, we go through this process. This is how care plans are put together through the nursing process. So the first one is assessment. We assess the situation. What is going on? We can do subjective, objective, we can put everything together in here. Then we have goal. Now, goals should be before problem solving because your problem solving will be different depending on what the goal is. Let me give you an example. What if you had someone who came to you after a large stroke? They had a cerebral vascular accident. They come to you and they say their goal is they're done. They don't want to do anything else. They've had it. This is maybe their fourth stroke. They've got a lot of other health issues. They're 97 years old, and this person's goal, now mind you, it's not your goal. It's not the nursing home's goal. It's your resident's goal. And they say they're done. How that might be much different. Maybe they want to go on hospice than in your problem solving than if this person had had a stroke. They come to you and they say their goal is to go home. I want to go home. That's what I want to do. So here, problem solving might be the first one if they were wanting to just stop everything and just be comfortable and let nature take its course. Then your interventions, your problem solving might be calling hospice, making sure you have his room set up in the most comfortable, home-like manner, so forth. If the goal is I want to go home, then it's going to be physical therapy, it's going to be getting him on track, it's going to be nutrition. So truly the goal makes a difference. So first is your assessment, next is your goal, the resident's goal. Next are your interventions or your problem solvings. What steps are you going to take? Who's going to do it and by when? How they're going to do it? And then finally the evaluation. Did it work? Let's do a real simple one. Okay, let's say Mildred. Mildred, the issue is that her blood pressure is 190 over 94. Okay? And that's high. That's hypertension. What is the goal? The goal is let's say Mildred was like, no, you're right, I could have a heart attack or stroke. I definitely want to get my blood pressure down. Okay, so let's try and get it down to, let's say, looks like my markers decided not to work, somewhere around 136. We want that to be our goal, over 80. We want it to be in this range. Now they can say between this and this. Okay, what are we going to do to get it there? Perhaps they ordered a new drug for her. Perhaps it's an ACE inhibitor like lisinopril. So they order the medication. And the dose, the amount, and so forth. Then here we are, in 1 month they're going to come back and evaluate it. So every day we're doing blood pressures on Mildred and recording those. So now a month later we're coming back and we're visiting. What are her blood pressures now? If they're within the range that we had set, great. Now we can move on to something else. If they're not, we have to go right back up here and follow these steps again. If they're still too high, look and see what's going on. What about her diet? What about her other drugs she's on? If it's too low, again, we need to modify and set our goals and our problem solving, and then the evaluation again. And that is the nursing process. So, again, this is how we work through issues. It is also how we need to communicate. So, a real pet peeve of mine, and I remember distinctly when I was a nurse, a young newer nurse working the floor, and someone come up to me, a CNA, and said, "Diane, I think something's wrong with Harold." And she was starting to turn away and walk away. I was in the middle of doing some assessments and administering some injectable meds. And I looked at her and said, wait. What do you mean you think something's wrong with Harold? I need more. Okay. So, is he breathing? Or is he mad because we ran out of scrambled eggs? There's a lot of space in there. So, when you go to bring an issue, do your homework first. And if you write it down, the angels will sing, you know. Issue with Harold. His blood pressure. Write down his vital signs, because otherwise what's going to happen? The nurse will say, go take his vitals and let me know, right? Use your subjective and objective. I think Harold's getting sick. Subjective. How do you know that? Because anything someone tells you, subjective. If Harold says, I'm getting sick, or if you say Harold's getting sick, I need objective. Tell me why you're saying that. Well, his temperature's 101. His face is hot and sweaty. Okay? That kind of thing. And then any other insight into that. Those are important. So objective is not more important than subjective. I don't want you to feel that. They're both very important. We need them both. Because if I only gave you objective, Mildred has tears coming from her eyes. Her face is red, and the veins on her neck are protruding. Okay, I'd be reading that and say, okay, what's wrong with her? Because there could be a lot of things. She could be choking. She could be having a heart attack. She could be really mad. Which one is it? I need the subjective to go along with that to give me the full picture. The subjective component of this might be, and she was waving her cane saying that if Harold came back in her room and laid on her bed, she was going to hit him good with it. Okay, that tells me the rest of the story. So as you can see, you need both the subjective and the objective to put together to make the full story.